Hi, I'm Dr. Michael McNamara. I'd like to welcome you to the Spine and Joint Center. We hope these educational videos will help you prepare for your surgery, and we look forward to seeing you at Williamson Medical Center and look forward to your successful surgery. Thank you.
I'm Dr. John Kleekamp. We've prepared this video to help explain some of the aspects of your spine surgery in regards to your stay in the hospital here at Williamson Medical Center. Please watch it.
Hi, thank you for choosing Williamson Medical Center. I'm Richard Hamilton, one of the physical therapists here at the hospital. Myself and some others on our joint and spine team are going to help walk you through some information you need to know about your upcoming surgery. Now that you are scheduled to have spinal surgery, we want to make sure you properly prepare for your upcoming surgery and that you thoroughly understand the process. In the following video, we will review what to expect before, during, and after your hospital stay. Prior to surgery, you will have an appointment with our pre-admission testing department. There, you will receive a pamphlet outlining the specifics on your type of spinal surgery. This includes information that will help you during your hospital stay and your recovery. Please bring your pamphlet with you to the hospital. Preparation for your surgery begins before you even get to the hospital on surgery day. It's important you begin preparing your home now for your return by making sure that your floor space is free from clutter to allow you to move about easily until your mobility has recovered. Keep in mind, some of you may need a walker for a short period after surgery. Some things to consider are throw rugs, loose cords, or anything else that may trip you. Keep in mind also that navigating around small animals may be problematic when you return home, so you may want to make some accommodations for your animals. If you have stairs, it is highly recommended that you have a handrail. It is very difficult to go up and down stairs without a handrail after surgery. It's also important that your home is adequately lit. We recommend considering night lights for when you need to get up during the middle of the night, and motion lights are also highly recommended. The bathroom is one of the most dangerous places after surgery because you have slick surfaces and lots of sources of water. A shower chair or grab bars may be helpful in preventing a fall in the bathroom.
Hi, I'm Amanda Morrison, and I'm the clinical coordinator here at the Joint and Spine Center. Staying healthy prior to your surgery is very important. If you have any signs or symptoms of infection on your surgery day, your surgery could be canceled and rescheduled. So we ask that you take a few extra precautions leading up to your surgery. Protect your skin by wearing insect repellent when outside, and be sure to avoid getting any kind of cuts or scratches on your skin, especially from animals. Should you experience a cough, cold, or flu-like symptoms, you should notify your surgeon prior to surgery. A side effect of pain medication is constipation. For that reason, we recommend you have a bowel movement prior to coming in for surgery. If you have problems with constipation, please take an over-the-counter stool softener to help with that. Some examples of gentle over-the-counter stool softeners are Colace, Senecot, and Miralax. If you're a smoker, we encourage you to try to stop smoking, as smoking is known to prevent healing of muscles, bones, and skin. If you're having a spinal fusion, this is especially important as we want the bones to fuse after your surgery. Taking NSAIDs, or non-steroidal anti-inflammatory medications, prior to or after back surgery is not allowed. These medications promote bleeding and can also interfere with the growth and development of your bone fusion. Some examples of medications to avoid are Advil, Aleve, aspirin, ibuprofen, and Motrin. If you're diabetic, then it's particularly important that you maintain your blood glucose levels both prior to and after surgery, as elevated blood glucose levels can impact your body's ability to heal.
My name is Lisa Matthews. I'm one of the registered dietitians here at Williamson Medical Center, and today I'm going to talk to you a little bit about the importance of having good nutrition prior to your surgery. Also, something to keep in mind, protein is important after any kind of a surgery. Protein aids in wound healing. Also, whenever we're inactive for 10 days even, we can lose up to 2 pounds of muscle. So to help prevent that muscle loss, we recommend snacks that are high in protein, high in fiber. You may be on some pain medicine, which can cause constipation. So to help prevent some of that, we recommend foods that are higher in fiber and drinking plenty of fluids. Some good examples of things to have at home before you go in for your surgery are these high fiber crackers along with tuna. This packet is wonderful because you don't have to drain it. You just open it, place it on the cracker, and it makes for a great high fiber, high protein snack. In addition, we have Greek yogurt here. Greek yogurt is a higher amount of protein than normal yogurt, so this is an excellent choice for a snack as well. Trail mixes, nuts are high in fiber and as well as a good source of protein. These are great to have on hand. After your surgery, you're not gonna feel like being in the kitchen doing a lot of cooking, so these are excellent to have around at your house. Also, we've got these drinks. There's many versions of these in the grocery store. The higher protein version that has the lower amount of calories is an excellent choice. Those will also help you maintain a good weight. We want to maintain a good weight because being obese or overweight adds extra pressure to our joints. So eating a great balanced diet, high in lean proteins and fiber, low in fats and sugars will help you do that.
Plan ahead to have help when you arrive home from the hospital. Depending on the complexity of your surgery, you may need help for several days. Make arrangements to have someone at the hospital by noon on the day of discharge to give you a ride home. A mid-size car or SUV works best for getting in and out of the car when available. Also, family and support are encouraged to attend and participate in any education you're provided during your hospital stay. Don't forget to bring your Joint and Spine Center educational pamphlet to use as a reference while you're here.
Hi, I'm Frances Scott, and I am the director of the Joint and Spine Center. The day before your surgery, you will receive a call to tell you when to come to the hospital the next morning. You will be instructed to arrive before your surgery time to allow our staff plenty of time to get you ready for surgery. Due to the complexities of back surgery, waiting is an expected part of the surgery day. We encourage you and your family support to bring a book, a crossword puzzle, or maybe you have a smartphone with games on it to occupy your time as you wait. You will be given instructions by your anesthesiologist as to when to stop eating and drinking prior to surgery and which medications to take the morning of surgery. Please follow those instructions exactly as given. Remember, eating includes gum and candy and no tobacco products. Don't forget to bathe with the antibacterial soap as instructed prior to coming in for surgery. The soap helps remove germs off the surface of your skin and helps prevent infection. You will want to pay special attention to the area where your surgery will be performed, and if needed, have someone help you wash that spot with the antibacterial soap.
Hi, I'm Samantha. I'm a nurse here at Joint and Spine Center at Williamson Medical Center. I'm going to talk to you today about getting ready for surgery. So when you get here, you'll come to your room where we will have you sign your consent. From there, we'll have you wipe down with our chlorhexidine wipes. These will help prevent any kind of infection, as well as getting into a purple gown for surgery. So after we get you all set up, you will be in your room until they come and get you for surgery. So if your family is here and they have any questions at all, they are more than welcome to come find a staff member or nurse up at the desk to ask any questions. After surgery, you'll be brought back to your room where we have two main goals, mobility and pain control. We'll be getting you out of bed as soon as you're back from surgery. Mobility helps prevent any kind of complications. Second goal is pain control. We want to keep your pain as tolerable as we can so that you can look forward to therapy and be able to regain your mobility faster. After surgery, we also encourage deep breathing. Anesthesia, drowsiness, being in bed can all prevent you from taking good deep breaths. That's why we use the incentive spirometer. With your incentive spirometer, you're going to wrap your mouth tightly around the mouthpiece. And here you will take good deep breaths by inhaling, kind of like sucking on a straw. As you see, taking good deep breaths moves the indicator up. Our main goal with the incentive spirometer is to prevent pneumonia after surgery or any other complications from anesthesia. You will do this about 10 times after surgery every hour. Another important thing to remember is that if you have a CPAP, to bring it with you the day of surgery so that we don't have any other further complications with breathing.
I'm Kristen Story, one of the physical therapists here at the Joint and Spine Center. I'm going to show you some proper body mechanics to ensure the best possible outcome for your surgery. The goal is for all of our patients to get up and walk on the day of surgery. This could be done either by a nurse or a physical therapist if ordered by your doctor. If you have a brace or collar, nursing or physical therapy staff will help you learn how to apply the brace or collar and what instructions need to be followed as you recover. We will now talk about getting in and out of the bed. To get out of bed, start lying flat on your back. Bend your knees, keeping your feet on the bed. Roll to your side, moving your hips, knees, and shoulders all together. Lower your legs off the edge of the bed while pushing your upper body onto your elbow, then push up to sit. Try to make this one smooth, fluid motion. Push from the bed to stand up. Perform these steps in reverse to get back into the bed. Now I'm going to talk about ankle pumps. Ankle pumps help with the circulation in your legs. Research shows that it increases the blood flow almost 200% compared to rest. Ankle pumps are a great active way for you to prevent blood clots. You can perform this exercise all throughout the day as often as you feel need. To perform this exercise, flex your ankles up and down. To go up the stairs, start close to the bottom step. Lead with the stronger leg if applicable. Next, step up to the same step with your other foot. Both feet should end up on the same step. Repeat for any additional steps. To go down the stairs, start at the edge of the step. Lead with the weaker leg. Next, bring the stronger foot down to the same step as the first foot. Both feet should end up on the same step. Make sure you bend at the hips and knees to prevent leaning too far forward. Repeat for any additional steps.
Getting you ready to go home is a team effort. Members of the team are you, your doctor, case management, physical therapy, and nursing. Based on your individual needs, discharge plans are developed and coordinated with the assistance of our case managers and social workers. If you require equipment or supplies to help keep you safe at home, we will work to ensure you have them prior to discharge. Our goal is to send patients home as soon as possible to promote independence and mobility. Now, Kristen with physical therapy will review how to safely get in and out of a car.
The front passenger seat is typically the best place for you to ride. Before getting in, have the seat pushed all the way back and reclined as far as it will go. This will give you more room during the transfer. Stand up from the wheelchair and pivot to back up to the car. Reach at least one hand back to grab either the dashboard or the seat. If you have handles available to grab, those would be fine as well. Be careful not to grab the car door as it could shut on you. Slowly sit down onto the seat. Once seated, begin to slowly lower yourself onto your right side, bringing your legs into the car at the same time. Once in the car and on your side, roll over onto your back. At that point, the seat can be brought up to a comfortable position. Perform these steps in reverse to get out of the car.
My name is Lisa. I'm a nurse here at the Joint and Spine Center at Williamson Medical Center. We want your transition from the hospital to home to go as smooth as possible. We are going to go over a few things you will need to know at discharge and what you will need to do at home. You will receive instructions on how to take your medications. The nurse will give you specific instructions on taking care of your incision. Notify your physician of any of the following. Pain. Your pain should be improving on a day-to-day basis. If your pain increases and is not relieved by medication, call your surgeon. Signs and symptoms of infections include redness, heat at the incision, fever of 101.4, and drainage at the incision site. The goal is to keep your surgical site clean and dry. If your dressing should become saturated with drainage from the incision, remove the dressing and call the surgeon. Notify your physician of any abdominal issues, including unresolved nausea, vomiting, abdominal pain, or unable to have a bowel movement. If you have trouble breathing or chest pain, call 911. Continue to take pain medications as prescribed. Watch for side effects, including constipation. Your doctor will prescribe an over-the-counter stool softener. Continue exercises as instructed by your physical therapist. To promote healing, also eat a protein-rich and healthy diet. Keep your incision clean and dry. You can shower, but no lotions, creams, or ointments. No submerging in water, meaning pool, baths, or hot tubs, until you're fully healed. No driving until you're cleared by your physician. If you have a neck collar, your physician will let you know as to when to wear it, when to remove it, but you can remove it for showering. If you have a back brace, leave it on as instructed by your physician. You may remove it when showering and when sleeping. For the initial 6 weeks following your surgery, your physician will limit your lifting to no greater than 5 pounds, and he will decrease those restrictions at your follow-up visit.
Thanks again for choosing to have your surgery at Williamson Medical Center. We hope our preoperative video has been helpful. Remember, our 2 main goals after surgery are getting you up and moving and keeping your pain at a tolerable level. If you have a question prior to surgery and would like to speak to a Williamson Medical Center staff member, please call 615-435-6040.